On August 22, 2003, a single tablet of OxyContin was mailed to a grieving mother in West Virginia with a note that read, "Take 2 every 4 hours, and you'll feel like a new person." That promise was a lie, and it was one of the first whispers of a crisis that would claim more than 500,000 American lives. Purdue Pharma, a privately held pharmaceutical company founded in 1892, had long been a staple on the shelves of doctors' offices. In 1995, the company launched OxyContin, a time-release formulation of OxyContin that it marketed as a safe, low-risk solution for chronic pain. The drug's extended-release mechanism was touted as a breakthrough, allowing patients to take it twice daily instead of multiple doses. What the public never heard was the internal research that told a very different story. In a 1995 internal memo, Purdue's scientists warned that the tablet's design could be defeated with crushing, exposing users to a rapid, intense high. By 1996, a confidential study revealed that up to 30% of patients reported cravings within weeks of starting the medication. Yet the company's marketing division dismissed these findings, arguing that addiction potential is low and that the drug's benefits far outweighed any risk. Purdue's sales force was transformed into a war machine. Over 3,000 sales representatives known as detailers were trained to visit physicians, hand out glossy brochures, and host lavish pain management seminars. In these events, Purdue's physicians spoke of responsible prescribing, while simultaneously distributing free samples that encouraged doctors to write repeat prescriptions. A 2000 internal PowerPoint slide read, "Our goal is to make OxyContin the drug of choice for chronic pain, and the profit goal is $1 billion in sales by 2005. The company's tactics extended beyond the United States. In the early 2000s, Purdue opened offices in Canada, Australia, and the United Kingdom, replicating the same aggressive strategy, paying key opinion leaders to speak at conferences, sponsoring medical journals, and funding continuing education courses that downplayed addiction risks. When the first lawsuits began to surface in the mid-2000s, Purdue's legal team responded with a playbook of intimidation. Settlement offers were bundled with non-disclosure agreements that silenced victims, while the company threatened counter-litigation against any whistleblower. In 2007, the U.S. Department of Justice finally took notice, charging Purdue and its top executives with misleading the public about OxyContin's addictiveness. The resulting settlement forced Purdue to admit that it had misrepresented the drug's risks and to pay $600 million in fines. But the damage had already spread like wildfire across Appalachia, the Rust Belt, and the nation's largest cities. By 2014, emergency rooms were filled with patients overdosing on OxyContin, and the streets of Dayton, Ohio, were awash in counterfeit pills pressed from the company's original formula. In 2017, a federal report estimated that Purdue's sales had generated roughly $2 billion in profit, while contributing to an epidemic that cost the United States more than $500 billion in health care, lost productivity, and criminal justice expenses. The turning point arrived in 2018, when a coalition of state attorneys general, local governments, and tribal nations filed a historic, multi-billion-dollar lawsuit against Purdue Pharma and the Sackler family, its owners. The complaint alleged a coordinated campaign of deception, accusing the company of knowingly flooding the market with a drug it knew was highly addictive. The trial that began in early 2019 was a courtroom drama unlike any other. Prosecutors presented internal emails that read, "We're pushing OxyContin like a drug of war," and testimony from former Purdue salespeople who described pressuring doctors to prescribe 300 milligrams a day, regardless of patient need. Defense attorneys argued that addiction is a complex disease and that prescribing decisions ultimately lie with physicians. Yet the jury heard harrowing stories of families torn apart, of children who lost parents to overdose, and of a small town in West Virginia where a single pharmacy emptied its shelves of OxyContin within weeks of its launch. After weeks of testimony, the jury returned a verdict that sent shockwaves through the pharmaceutical industry. Purdue Pharma was found liable for public nuisance, deceptive marketing, and wrongful death, with damages set at $8 billion. The ruling also held the Sackler family personally responsible, opening the door for future civil suits against the family's vast fortune. In the months that followed, Purdue filed for Chapter 11 bankruptcy protection, a move that allowed it to reorganize while still paying the billions owed to victims. The company's assets were placed into a trust that would fund a nationwide settlement, estimated to reach $10 billion. The Sackler family agreed to relinquish ownership of Purdue in exchange for immunity from future civil lawsuits, a controversial decision that sparked nationwide debate over corporate accountability versus individual responsibility. The aftermath of the case has reshaped the landscape of opioid prescribing. The Centers for Disease Control and Prevention issued stricter guidelines for chronic pain management, encouraging doctors to consider non-opioid alternatives first. Medical schools now incorporate opioid stewardship into their curricula, and many states have instituted prescription drug monitoring programs that flag suspicious prescribing patterns. Yet the human toll continues. Communities still grapple with orphan children, a surge in heroin use as users turn to cheaper alternatives, and a lingering stigma that prevents many from seeking help. The opioid crisis has also prompted a broader reckoning with how pharmaceutical companies balance profit motives against public health, leading to new legislation that demands greater transparency in drug marketing. Subscribe to The Verdict for more stories like this.